Welcome to the Sage Women podcast, hosted by Melanie White and Dr. Nick Engera. We have real conversations with real women, health professionals, and coaches who share stories about perimenopause, menopause, and a range of women's health issues. Please subscribe so you get the latest updates every fortnight.
It's Melanie White with the Sage Women podcast, and I'm very excited to introduce our guest today, Dr. Tabitha Healy. Tabitha, welcome, and thanks for being here.
Thank you so much for inviting me to be with you, Mel. I'm looking forward to it.
Me too. I know you're such a great speaker, and I'm very thrilled that you're here. And instead of giving a bio that's stuffy and boring and raving on, tell us a bit about you and how you got to where you are today.
Fabulous. Well, it's a fairly unorthodox journey for a coach from the point of view of I started life in medicine, became a medical oncologist, largely because I was terrified of blood. So it was one of the specialties where you didn't have to see too much blood. Should have found that out slightly earlier in my career, would have been useful. I was a medical oncologist for probably about 20 years, specialising in the care of young women with breast and gynecological malignancies, which was a truly beautiful area to work in. But what I discovered over time was that I was just becoming more and more fascinated and enamoured of the well-being side of things. So I spent a lot of my time making people extremely unwell, spent a lot of time pushing women into premature menopause, and realised we weren't very good at putting the pieces back together. And then a whole lot of things conspired at around the same time. I had young kids, work was challenging, so I decided to step out just before I turned 50. And then I spent some time working in a hospice with palliative care patients, and working with people who are dying is just an extraordinarily privileged and beautiful place to be. And it also allowed me to think about how did I really want to be spending my time. So I studied to be an executive health coach, and that's evolved into it wasn't meant to be a full-time job, but it ended up being a full-time job again. And I work with a lot of women in their mid-career phase of how to maximise their health, well-being, but also their pleasure and enjoyment of how they work.
Sounds like a big transformation for you.
It has been a fabulous one. It was interesting. I was at a retirement party for one of my colleagues recently, and he said to me, "So how do you feel now that you're no longer relevant?" And I went, "Oh, okay." That question, and it was then I realised that I'm probably more relevant now than I used to be, because I was caring for people when they had so few choices, and that the lives that they'd led had often, ended up in that situation where their cancer was dominating. And now I feel that I get to intervene at a much earlier stage where people get to make a choice about how they live, how they work, so that they live the life that they want to, and that whatever happens down the track, there's no regrets about the choices that they've made, or if there's been regrets, that they've learnt from them when they've got enough time to redirect and reset. So it's incredibly fabulous, and it was wonderful to see his face fall because he was so disappointed.
Oh, little slap along the way. Yeah. I'm really interested in why your work is so meaningful for you.
So when I was trying to determine what could I do after medicine, because medicine you get so highly specialised, and in order to change direction, you have to retrain. So I was looking at having to spend another 6 years to change my medical field, and I thought I can't possibly go back to being a junior doctor again. So it was sitting down and thinking about what are my skill sets, what do I enjoy, and where can I make a contribution. So certainly communication is a thing. I love chatting to people. Positive psychology, well-being, that human connection. So coaching sort of came out of that space for me, and I guess the power that I bring is the background in medicine, which is really helpful. So everything that I work with people is based on solid scientific randomised controlled data. So my science background really drives the conversations that I have. And I think it's the authenticity that comes from having spent a lot of time talking to people who are on the edge.
Yeah.
And when people are getting too caught up in the small stuff, I can bring them back to, well, is this cancer? Are you dying? No. So let's put this in proportion. And so I think that gives me a touch of gravitas. So it's been a lovely blending of my interests, my skill sets. And I remember I was seeing a coach at one stage and they asked me the question of, what are you reading? What are you listening to? What are you watching? And it was like, oh, I'm reading wellbeing, psychology, and health outcomes. And it was like, oh, okay, there's my career. So that was such a great question for me in terms of where was my mind and my time naturally going? And it was to this space. And I guess the menopause space has evolved from there. So as I said earlier, I spent so much of my career inflicting premature, very abrupt, very brutal menopause on women because of their chemotherapy or their surgery. And I look back now and I'm horrified about how woefully unskilled I was to be working in that space. And I used to just, say to people, it's a matter of, exercise and what you eat. And I really didn't take into account the hormonal milieu. And my practice has sort of evolved largely because of a GP in Adelaide who her specialty area is menopause. And so she is the queen in this space. And what she was seeing was that she could help people with their hormones, but there was so much happening just outside of that pure medical context in terms of the chaos of people's lives, the incredible demands on women from so many different directions that society now has. And so she started sending all of her patients to me as clients saying, I can deal with your hormones, but you need to see Tabitha to deal with everything else. And so my practice inadvertently evolved to really having a very large focus on midlife, upper career women, and then trying to find that balance between, and I'm sure you've discussed this on your podcast before, but that they have children, younger children, because we've all had children later. They've got aging parents. They're often trying to peak in their career space. And the area that's particularly bad, of course, is the perimenopause because it's not recognised. So they feel that it's a personal failing, a personal lack. Menopause is often easier. Once the hot flushes come, people go, oh, menopausal, and then they can piece the pieces of the puzzle together. But it's that, 35-year-old female group onwards where they just feel that they're failing in every sphere of their life, as a parent, as a partner, as a child, as a professional. And so that part of my practice has really evolved. And so I've had to really do a lot of upskilling, and I'm still got a long way to go. But I just look back now and think, oh, if only I knew now. So I knew then what I know now and how much better care I could have taken of my patients at that point in time.
Thank you for being open about that. There's a lot of conversation about how well educated doctors are, and we don't actually hear a lot from doctors about this. And you being authentic is one of your strengths. I really appreciate that you've said, I knew nothing.
It would be a minuscule component of medical school. If you end up in a specialty area, then you would learn about it. But if you're in any other area, it really didn't come up. And as I said, my horror is that I was doing this to women and yet not having a full understanding. So I thankfully had a fantastic GP sex therapist who worked closely with us. And so, of course, libido's disappeared, vaginas are as dry as anything. So I would off to see the sex therapist, and she was magnificent. So she plugged a lot of the gaps. I can still always remember one patient walking in one day. She was a youngish woman. She said, "Can you hear that noise?" I said, "No." And she goes, "I'll walk across the room again." And she walked back across the room. She said, "Can you hear it now?" And I said, "No, I can't hear anything." She said, "My vagina sounds like your corduroy trousers when they rub against it." She said, "That is how dry my vagina is right now." And I just remember absolutely cracking up laughing, but it was that thing of like, oh my goodness, we're doing such a bad job. And so getting her off to see someone and getting that sorted. But yeah, we don't do a particularly good job of this in medicine. I think there, as you know, with SAGE and with this space, it is exploding because suddenly there are women who are trying to hold down careers and families at this point in their life, and they're just starting to shout louder and louder that the way that we've been dealing with this is not good enough and the situation needs to change. So
it's a lack of knowledge for our whole generation. I mean, we're all taught about puberty at school and we don't have this education. So it's no wonder that none of us, health professionals included, have had that education and training. And I'm joking about things now that I wouldn't have even understood 10 years ago. Like you're saying, for me, VA used to mean virtual assistance, but now it means vaginal atrophy. I can't unhear that, you know. So I think we all also get that lived experience of going through it and working with people who are going through it, and then realizing how much of a thing it is and how many intricacies are involved. I mean, it is definitely a biopsychosocial, all those influences coming through that as a health professional, you're seeing them for one small segment, and yet there's this gap. Follow-up support, complete support, holistic support.
Yeah.
Navigating all those areas.
You're absolutely right to bring it back to time as well, because GPs have 9 minutes with someone. I used to have 15 minutes with a cancer patient to discuss their treatment and the impacts and survival. And so women would often say, well, the state of my hormones just didn't seem as important as discussing my survival. And so I think that's where the beauty of health coaching comes in, is because you have the beauty of time. So, I now spend an hour with a client as compared to 15 to 20 minutes previously with all those other issues. And now it can just be down on this. And I think that's where we need to see, yes, medicine is inadequate, but there is no way that in standard consulting times can enough time and energy be spent educating them appropriately. And I think that's that beautiful intermingling, medicine to diagnose, to recommend a treatment strategy, but then health coaching to come in alongside of that, to actually be with women to understand what matters most, what's important, what are the impacts for them, and then how can we formulate a way forward for them to take back ownership once again of their own bodies, because medicine remains very, very authoritarian. We tell people what to do and we wonder why they don't do it, but that's because we haven't engaged with the why. And so health coaching for me, once again, beautiful set of tools, which I wish I'd known when I was a doctor, to have flipped all this back around to what is it that you want? What is it that matters most to you, and how are we going to achieve that? And what's the first small step we can take in order to achieve that? So I think it's a great space for health coaches to be involved with, which is how do we empower women to recognise their own bodies and to take back control and to feel well, powerful and strong, so that they can continue to work, continue to care, and continue to design their own lives.
Yeah, and at the risk of being controversial, obviously there is a place for hormone replacement therapy, but it's not the only solution. And I'm wondering what your thoughts are, not specifically on HRT or MRT, but how do we make people aware of all of the treatment options, not just medication?
So the way that I discuss it with people is I first of all educate them on what are the hormonal changes, that it's not just a lack of estrogen, it's the withdrawal of progesterone. And often when I particularly explain to women that losing your progesterone is like losing your natural Valium, and suddenly you can't sleep and you're irritable and the sound of your husband breathing makes you want to kill him. So it's that sort of discussion around it. And then I say these are the lifestyle factors that can be utilised to counterbalance that, because that whole drop in hormones pushes up your cortisol. These are the impacts that cortisol have on your system. So these are scientifically based strategies that will start to bring cortisol down. So I have a set framework that I talk to people about that they can then select from. And then I say, look, when you're doing all of that, if hot flushes are still so debilitating that you can't sleep, you can't walk, if your brain has left the building and it's impacting on your relationships and your ability to function at work, then hormone replacement therapy is absolutely a useful tool to take. But if you don't change any aspect of your lifestyle and you just rely on HRT, it's a Band-Aid. And then the moment that you try to take that Band-Aid off, you're going to end up right back where you were. And I also talk to them about the fact that HRT may modulate some of the symptoms that they're having, But unless they start to make changes in their lifestyle for the change in their metabolism, the change in their hormonal milieu, they're not going to be able to stay fit, strong, healthy and independent into their latter years. And so I often do get them to visualise what would life be if it continued on the current trajectory, and what would life be like if you were able to shift that. So I, in some cases, do recommend people go and see doctors about HRT, but I do say to them that doing that on its own is not going to solve anything for you.
I'm not going to open the can of worms, but I'd love to see how we get that message into the medical system so that people are aware of all of their choices.
And I think that's a fundamental challenge with the medical system. It's designed from a disease framework.
Yeah.
You know, everything that's taught in nursing, everything that's taught in medical school is a hospital-based illness model. And until we shift that fundamental principle that it's 50-50, 50% is disease-based and how we treat it, and 50% is let's actually stop these things happening with lifestyle modification, then we're going to have those challenges. Talking to people who are involved in medical school education, it's coming, but it's incremental and it's slow. But, you know, we're going to have to shift. But the problem's going to be we are going to be way too late for the tsunami of ageing and illness that is coming our way, which is why the health system is in crisis at the moment.
Mm-hmm. Not something we can tackle in this conversation. So shifting over to your specialty, I know that you do a lot of work with women who are going through burnout. Is that correct? Yeah.
Yes, and this once again evolved from, I started my coaching practice during COVID. And so what I faced was a lot of medical specialists and senior nursing teams coming to see me about burnout because of the impact that COVID was having on them. So one of them just had to evolve in terms of learning more and more about burnout, understanding it, and then how do we combat that. And I think the challenge in the midlife space for women is that so many of the features of burnout would be also the features of menopause, and they both probably feed directly into each other. So burnout, the three criteria are: you become detached, you become ineffective, which is that you perceive that you can't do the things that you need to do, and you become absolutely exhausted. So both of those could fit in both sectors. The one, I guess, that leads me more to seeing that burnout is an issue is the detachment and the cynicism, particularly in a work framework. But the other two completely can sit in the menopause framework. And once again, the beauty of it is that the management of burnout and the management of menopause are both largely underpinned by lifestyle modification. And so you can drive benefits for people by coming back down to those pillars of health and wellbeing.
Before people come to see you, Tabitha, how are they coping with the pressures of life, with burnout, with menopause? What are some of the common health behaviours that you see or don't see?
But sadly, by the time I see a few now, once again, because of my reputation in Adelaide, which is fantastic, which are coming for prophylaxis. So they're coming along because they've heard of the work I'm doing with other people, and they come and they say, look, I'm great, but I just need to ensure that I've got everything in place because I don't want to fall off the other side. But the majority of people I see would be people who are in crisis. So for a lot of them, they're contemplating leaving their jobs, or they're looking at leaving their relationships, or that they have very fractured relationships with their children, or that they're developing the health outcomes. And so that might be carrying excess weight, really struggling with sleep, type 2 diabetes, hypertension, but often it's anxiety, overwhelming anxiety, and in some it's depression. But the commonest one I'd see is just people coming completely overloaded, and every sphere of their life they're just describing as being out of control. And so first session's often about how do we start to identify where you have control, and then we start to work out from there. But it's a cacophony of symptoms that I see.
And probably a variety of different coping mechanisms for those symptoms too.
Absolutely. So food, incredibly common. Technology is probably the other significant one I see, and then self-soothing with alcohol is the other big one.
Yeah, the great triad of Doritos, wine, and Netflix.
Absolutely. And so people just seeing that that's all they've got left. So a lot of conversations around how do you replenish energy rather than actually continue to drain.
And that's a good point, because those things can feel like replenishing at first. You think that the alcohol is going to calm you down, but you're not thinking about what it's doing physiologically, raising your blood pressure, making it hard for you to sleep, or that the Netflix is helping you dissociate or calm your mind, but not necessarily. Maybe it's just delaying or deferring or avoiding something that's difficult. So what are some things that do work for people? And I'm saying this from the perspective of I've been through burnout about 15 years ago, and it's horrible. And I know how debilitating it was. And it can feel really challenging in menopause, or if you're burnt out, to think about, well, how do I start changing some of those things? So I'm kind of curious as to, for people that feel like they have less capacity, what are some of the common things that they start with?
Well, I guess if I frame it from a point of view of an example in terms of how we break it down very simply, and to say that the whole state of both burnout and menopause are too much cortisol, the stress hormone in your system. Yeah. So talk to people about what are the things that we need to do to bring your cortisol down. And if I give an example of a woman that I saw who was late 40s, young child, relationship breakdown, when I saw her work was disintegrating. She was in a very toxic workspace with a lot of, but she was trapped in it. She couldn't get out of it for various reasons. She was in financial disarray. She wasn't sleeping. She was self-soothing with alcohol and food. And when I saw her, her answer to every question was, I don't know. She was so overwhelmed. She just couldn't see a way through it. And we discussed the cortisol and what were the smallest steps that we could take to start to bring that down. And so for her, it was simply getting up 15 minutes earlier in the morning, stepping outside. She had a park across the road. And so it was that aspect of getting up, getting natural light into her eyes to reconnect with her circadian rhythm, moving her body gently, so not exercising hard because that puts cortisol up even higher. So moving gently, being grounded in nature because that brings cortisol down so successfully. And while she just moved through the park, that she would breathe. And then that was step one. And I saw her a couple of weeks later and starting to notice a difference. So that sets you up for your circadian rhythm. So sleep starts to improve, starts to bring cortisol down, so sleep improves. As sleep improves, it allows you to wash the build-up of sort of proteinaceous accumulation of stress throughout the day, so your mind is clearer, you think more clearly. And then the next step from there was just integrating small, tiny moments of breathing throughout the day, once again, just bringing her cortisol down. And then we just started to use Shanao's car ride to and from work. And so we started to use that car ride. Instead of, she used to make phone calls and would still be working, and we just started to use that car ride to shift her headspace, to shift her into a better place, so that when she arrived home that she'd reset to be with her daughter. And so that process occurred over about 6 weeks. And in that time, there was just this extraordinary shift. So saying to people that it can be very, very tiny, and you have control over how you move your body, you have control over what you put into your body. Ultimately, you have control over your thoughts. And so what are the steps that we make for that?
And it's funny because people listening to this might be thinking, oh, I've got to go on a diet, or I've got to start going to the gym, and what you've just described is very different from that and very accessible to everybody. No special equipment, no fads, just some really simple steps to create time and use segments of time in a different way that calms down the nervous system and lowers cortisol.
And my favourite quote that I use with people is a Buddhist one from I saw Sogyal Rinpoche speak many years ago. And he said that water that is not stirred becomes clear. And so that aspect of women in particular are constantly churning between work and family and friends, and often, trying to be the best for everybody else. And so talking to them about if we just carve out these moments of quiet and these moments of stillness, the dirt can start to settle to the bottom and the water will become clear, and then the way forward becomes clear. So really in the first instance, they're also highly, highly charged. It's how do we get your cortisol down? How do we get you sleeping? And once we get you sleeping, that then starts to set up that you've got more energy, your mind is clearer, you begin to make better food choices that resets the hormones in your system in terms of food choices. It allows you to start to move your body more, and that it allows you to work more clearly, work more productively. It calms your emotional reactivity. So it tends to be that process for me. And as we well know, people in this space, when women start to gain weight, often they just start going, right, I need to diet, which is often stressful, and I need to train harder, which is really stressful, puts cortisol up. So step one's actually take it down and then gradually start to build on that once you feel that you're getting that clarity, that sleep, that control back in.
Something else I thought I heard you talking about in that example, although you weren't explicit about it, is it's not about just what you're doing in the day. It's the transition from one to the other, from waking up to getting to work, from getting to work to coming home. It's that, to me, I think about triathlons and they say the hardest part of the triathlon is not the swim. It's changing from the swim into the run. It's that transition that's the challenge, right?
Oh, absolutely. And it's they refer to it as third space. So particularly for women, there's work and there's home, and they're often just merging the two. They're still working as they arrive home, or when they're at work, they're still trying to deal with the household. And so often just that 10 minutes of transitioning. So I talk to people about when you're leaving work, choose at what point on the trip home that you close that down. So perhaps it's a particular set of traffic lights, and you can think about work all you like and plan all you need to, but at that point on the trip home, you start your transition into arriving at home so that your family get the best part of you, or you get the best part of yourself. Sometimes I say pull off, in the street before you reach home. Never pull off outside the house because the kids get really worried when they see you and you don't. Pull off around the block, just sit in the car for 2 minutes and breathe. My favorite technique that I have for clients, I should say, is I just get them to hover their hands over the top of each other, to take a deep breath in, and as they breathe out, just to close their eyes and take their attention to the electricity between their hands and just marvel at the sensitivity in their fingertips. And that can take 30 seconds, but what it does is it takes people out of their minds and just drops them back
into their bodies. Yeah.
Doing it just calms them down, because a number of my clients are very anxious, and so asking them to focus on breath can sometimes make them more anxious. But I find that the tactile sensation of just that really quick activity, they feel that they're escalating throughout the day, just to take it 30 seconds between meetings or between pulling in a client or having to go to that feedback session, which they're uncomfortable with, just to center themselves back in their bodies, quieten and calm their minds. In doing so, it allows them to drop back into their frontal lobes, which is their incredible library of their resources. So by calming their mind, calming their emotional center, you open the library of your experience, your knowledge, all of those things, and then the way forward becomes clear. So I find that really useful.
It sounds like a really well thought approach, Tabitha, from my humble opinion, that just helping people to feel calm. And I really relate to what you're talking about. It's one thing to say breathe, but I've been someone who's been prone to anxiety in my life, and I know that rubbing my fingers or wiggling my toes is the only way to disengage my brain. I have to do, or pulling weeds or something. I have to do something that's tactile. I know it sounds funny, but that's how I prepare for coaching sessions too. So I pull out weeds, go in the garden, pull weeds, get in the sun. Something about it is so soothing.
You've got movement, you've got, out of your head, and you're grounded. And so for a lot of people as well, it is that thing. I tell them just to go outside, just to see the sky, to touch a tree, if they can take their shoes off. And there's been some really interesting work coming through about electromagnetic fields and menopause. And so just that aspect of getting outside and getting your feet into nature has been shown to down-regulate cortisol. And I use this example all the time when I'm doing public speaking, particularly to medical audiences, about the benefits of nature. the Japanese have this lovely concept called Shinrin-yoku, forest bathing. And they did this really simple study of type 2 diabetics. And so they got half of them to walk in the forest, half of them to walk in the city. And they both walked exactly the same amount. And the group that walked in the city dropped their blood sugars by 20%. And the group that walked in the forest dropped their blood sugars by 40%. And so this incredible impact. And they measured their cortisol along the way. And they had a similar significant drop in cortisol. So just that aspect of getting people to reconnect with the outdoors. And as you said earlier, these things are free, they're readily available, they don't require a lot of time or equipment in women that have got a lot going on, but they're incredibly effective. And it just comes around to, can you prioritise them? Because I think for busy women, it's often that thing of, I can't possibly add anything else to my day.
Yeah.
I am so busy, don't ask me to put anything else in. And so when you start to put in these micro moments of touching, breathing if it's appropriate, stepping outside, noticing the natural environment, everyone can find time for that, whatever it is that's going on in the world.
Absolutely. It's funny, I'm just thinking we spent all these years building great cities and making beautiful shoes. And here we are, take off the shoes and walk in the dirt.
Absolutely. And it is, we've become detached. There was something I read recently, and it was adult Australians spend less than 18 minutes per day outside.
Wow.
And so prisoners get 2 hours because they have forced time outside. Children get it when they're at school because they have recess and lunch. But then often as they get older, that time outdoors diminishes. But when you think 18 minutes a day, it's horrifying. And we're designed to be outdoors, in motion, connected with the natural 24 hours, the circadian clock. And particularly in winter, we'll get up in the dark, we'll go to work in the dark, we'll spend the day under natural light, we'll come home in the dark, we'll once again go under natural light. And then we wonder why we can't sleep, because our poor bodies and hormones have become completely detached from that natural rhythm that guides us. So I talk a lot about allowing your hormones to work for you rather than you having to do the work. So if you set up the system of your circadian rhythm, these hormones will start to do what you need them to do. So cortisol, melatonin, your ghrelin and your leptin in terms of your sort of metabolism hormones and your hunger hormones. And so all of these things can actually be put back into sync by simply connecting with the natural way of the world and the natural flow of the day.
There's so much that women can learn to do for themselves, so much self-responsibility and sense of control that we can gain. And I wonder if you have thoughts on any changes that could be made to workplaces, because it's one thing to get outside and get that natural light, but if you have a demanding job where you're locked in an office all day or a lab or something like that, it's pretty hard to get in and out. So what might be some things that workplaces could do to help women at this very difficult time?
And I would broaden that apart from being just women. I think workplaces in general,
everybody,
understand how unhealthy they are. And particularly when you've had the advent of open plan offices, designed for saving on space and, creativity and connection, but the noise, the chaos, the interruptions. So I think workplaces in general need to think about what can they do to maximise productivity and the health of their workforce. And so it might be things of going, if it's winter, that we encourage people to actually take a break and to go outside so that they can get natural light within a couple of hours of getting up. Creating a culture, which needs to start at the top, of that we encourage people to move around. Changing this mentality of back-to-back meetings, particularly in the Zoom interface, to that meetings, okay, if they're usually 30 minutes, make them 20 minutes with a 10-minute break. If they're normally an hour, make them 50 minutes with a 10-minute break. There's been some work done by Microsoft which demonstrates a 10-minute break between each meeting completely resets the electrical activity of people's brains as compared to if they go back-to-back. Allows them to stay in their frontal lobe. So the data is so strong from a workplace perspective that if you get people to have micro breaks, if you get people to move around during the day, you increase their focus, their concentration, their productivity. If you ensure that the food that's available in the workplace is actually food, not ultra-processed substitutes for food, if you access to water, if you've got access to natural light, if you've got access to spaces that people can retreat to in order to do deep work without interruption, if you create a culture where people can announce that they're doing focused work and people then know that they will reappear at a certain time. So I think that goes for anyone in the workspace, but particularly women who are finding the overwhelm increasing in that midlife period. And so I think it is all of these things are essential and often overlooked. And I agree, I hear it all the time, particularly with my medical clients, general practitioners, who I see are the ones that are suffering the most. And they say, well, what am I meant to do? I've got back-to-back appointments all day. And a lot of them stop drinking water because they don't even have time to go to the bathroom. So they say, well, I don't drink because then I'd have to have a work. And then you go, okay, well, how do you structure your day? Where do you build in the breaks? How do you educate your patients as to how long those appointments are? So that they know they've got 10 minutes and how to prioritise it. Making sure you've got water on your desk, knowing that you can breathe or you can pause for 30 seconds between patients, and it's actually going to increase your productivity, not take it away. And really bringing home that factor, if you've got someone who arrives at work in the morning and they don't replenish their reserves, then their productivity by the end of the day is actually very low. Whereas if you have a workforce where they work in segments and they work hard, then they break, they reset or take a pit stop, and then they go again, you're actually going to increase your productivity.
It's very interesting, isn't it? It makes me think of Parkinson's law. There's the amount of time that you have for work, and then you will fill that time. But actually intentionally creating the structures to have the breaks to be focused, so much better for well-being by creating that space, but also for productivity.
Oh, absolutely, because within our circadian rhythm of 24 hours, we have ultradian rhythms, they vary between 90 to 120 minutes for people. And that's your peak productivity, and then it wanes. Now, if you don't recognise the waning and reset, you simply keep going down. But when you recognise that your concentration's starting to falter, you're yawning or you're getting restless, then if you actually have a pit stop or a mini break, you reset your ultradian rhythm and your productivity goes up again. So drawing that for people can be really useful, educating workplaces on that and going, right, we need to break, reset. And you look at, athletes, they don't just keep running unless you're an ultramarathon runner, but they train and then they recover. They train and they recover. And that's the same for our brains in terms of our ability to focus and concentrate.
So interesting, Tabitha. I see we're at the end of the time we agreed, and I could talk to you for another couple of hours if you had the time. But I think we've covered everything that we agreed to talk about today, and I'm so thankful for you sharing your knowledge and insights and giving us some really specific examples of what works, how simple it can be to get started, and what some of the challenges are and how we might start to address those. It's been really insightful.
Thank you so much for your time, Mel, and love what you're doing in this space and advocating for women to keep them well and productive.
Let's keep doing that. And I'm going to put some links to your contact details in the show notes for this episode for anyone who's interested in knowing more about what you do.
Fantastic. Thanks so much, Mel.
Thanks, Tabitha.